If you have lumbar spinal stenosis and you've tried everything, but you're only getting short-term relief, it might be because you're doing one or more of these 10 worst things that make lumbar spinal stenosis work. I'm going to show you exactly what these things are so you can break this cycle and protect your spine. Number one is prolonged standing or walking, because people with lumbar spinal stenosis, it's a narrowing of the nerve canal, the spinal canal where the spinal cord and the nerves go through. And when you walk, it can put axial compression into that area. Also, it creates a little bit of extension, and that can create venous congestion, where that swelling is building up within that canal and creates further compression in that area, and it leads to a classic trigger of neurogenic claudication. Those people are going to have that tingling, numbness, weakness, maybe cramping, some pain when they're standing or walking for long periods of time. But it's eased when you sit or bend over. Hi, my name is Dr. Rob Bates. I'm a chiropractor and a certified athletic trainer. I've had a history of moderate to severe lumbar spinal stenosis. It got so bad to where I couldn't walk more than a few feet without having to stop because of the symptoms. With the information that I go over in these other videos on lumbar spinal stenosis, for example, the one on how to walk with lumbar spinal stenosis, I began to walk miles at a time without getting those symptoms of lumbar spinal stenosis, and I got back my active lifestyle. So when you finish this video, make sure you check out the one on how to walk with lumbar spinal stenosis. Number two, lumbar extension or arching your low back. When you arch your low back, once again, it's going to close down that and narrow the nerve canal, and it's going to aggravate the condition. And it's activities like just reaching over your head, or it could be standing, or it could be some yoga poses like the cobra. All these can create extension. It can narrow down the hole, pinch the nerve, and create some flare-ups. Number three is heavy, improper lifting. When you're lifting heavy repetitively and you're using poor mechanics, then that can flare up that lumbar spinal stenosis. Or another example could be if you're at the gym and you're performing overhead presses, and when you perform the overhead press, you're not bracing properly, using proper technique, to where now you're going to overarch your back, and it's going to create a lot of compression through the spine with that weight, along with extension, which really flare up and irritate that area. Number four, high impact activities like running and jumping. Number five, repetitive twisting activities like golf. All these will increase the pressure on the spine, along with that compression and torque, and put a lot of pressure on the spinal discs, the joints, and the ligaments of the spine. For example, running puts about 3 to 4 times the body weight on that spine. The golf swing puts about 8 times the body weight on its spine when you swing that driver. And jumping puts about 10 times the body weight. When you put those types of compression and type of torquing type of forces, it causes a lot of stress on the spine, and it can create micro movements of the spine. When you create the micro movements, it can slip, it can close down that nerve channel and pinch the nerve and create those symptoms of lumbar spinal stenosis. When you check out my other video on the best core exercises for lumbar spinal stenosis, we're going to show you how to strengthen, stabilize, and stiffen up that spine so it creates muscular endurance to where when you go out and you're doing activities, you're going to have less likelihood of getting those micro slippages of the spine and causing a pinching of the nerve and flare-ups. Number six, poor posture, or that forward head posture, the old man posture, the hunchback, kind of the flat back syndrome. It's classic that people with lumbar spinal stenosis are going to have that flex posture. When you have that flex posture constantly, it creates misalignment of all the spinal joints. And when spinal discs and joints are constantly out of alignment, it can facilitate the arthritis. And the number one cause of lumbar spinal stenosis is osteoarthritis. So we got to correct the posture. So check out our video where it shows home exercises where you can correct your forward head posture. Number seven, non-steroidal anti-inflammatories like ibuprofen, Advil, Motrin, Aleve, Tylenol, aspirin. Also number 8, which is repeated use of steroid epidural injections. And number 9, icing. All these are really good for short-term pain relief. Especially the medications and the shots have a tendency to mask the symptoms and cover up the progression of the lumbar spinal stenosis. And studies show that it definitely interferes with the natural immune system's ability to create inflammation and heal that area and regenerate those joints. So it will facilitate the joint destruction by using prolonged use of anti-inflammatories and steroid injections. Also increase the chance of just having chronic pain syndromes with lumbar spinal stenosis. So I found for myself and my patients is to stay away from those things that are derailing us from getting long-term benefits and healing of the joint and actually getting better results by using this information I have in how to get out of pain as soon as possible with lumbar spinal stenosis. Make sure you check out our video on that. Number 10, stretches and exercise that only target the symptom. So when people have lumbar spinal stenosis, it's best to use flexion type of exercises initially to get you out of pain as soon as possible. However, some people just go to the flexion exercises, repetitive bending and twisting type of exercises, and eventually it'll have diminishing returns because you aren't getting at the cause of the problem. For example, people with lumbar spinal stenosis typically are going to have trouble standing or walking for long periods of time before they start getting the flare-up. So they're taught by their physical therapist or their doctor to have more of a pelvic tilt posture. So they tuck your butt underneath. That flexion will increase the diameter and take pressure off the nerve. So it allows you to walk and stand for longer periods of time when you have this tucked posture. But there's a lot of adaptation that starts occurring because the patient will start leaning forward to compensate, and that's where they start getting more of that C type of curve, and it facilitates the forward head posture, the hunchback, and the flat back. So that's why it's very important just to use the flexion-based exercises just for short-term pain relief, and then start moving into more of a structural rehabilitation of the spine to where it gets back to more of a normal posture and normal curvatures of the spine. So by avoiding these 10 things that make lumbar spinal stenosis work, along with adding in the information I have in my playlist for lumbar spinal stenosis, you're going to go from pain relief to long-term benefits with the lumbar spinal stenosis, just like I did. Now I realize that everyone is different. Everyone with their lumbar spinal stenosis is going to be different in what they're subjected to. If you have any questions or concerns and things that you want me to bring up in maybe other videos and answer it and what we did for those type of people with my practice, then go ahead and make sure to comment down below and we'll make a video on that. Make sure you subscribe, you give this information, and spread the word to other people that really can use this information. We really appreciate serving you. Have a great day.